You need to review pericarditis, myocarditis, and endocarditis because they're coming out in your NCLEX. Okay, so remember, when we talk about pericarditis, we're talking about inflammation in the pericardium. Whereas when we're talking about myocarditis, it's on the myocardium. However, if we're talking about endocarditis, it's a combination of the endocardium as well as the valves. So what are the NCLEX clues that you need to know when it comes to these three complications of myocardial infarction? The first thing is there is a sharp pleuritic chest pain that's always associated with pericarditis. And then the patient usually feels better when it comes to this pleuritic chest pain if they lean forward. They're also going to feel friction rub. Whereas in myocarditis, you're going to have fatigue, you're going to have chest pain and tachycardia. And remember, because it's in the myocardium, you're going to see signs and symptoms of heart failure. Endocarditis, on the other hand, is quite different. One of the distinction is that you're going to see fever in the clinical setting that they're going to give it to you. You're going to have some murmur, you're going to have some fatigue, and some hemorrhages and splinter hemorrhages. That's what we call it. Now, what are the other signs and symptoms that you need to watch for? So the classic signs that it's going to be telling us that this is either pericarditis, myocarditis, or endocarditis are this couple of examples. Diffuse ST elevation, that's what you're going to be seeing with pericarditis. As I mentioned earlier, in terms of myocarditis, you're going to have heart failure signs and symptoms and several dysrhythmias. And then, of course, in endocarditis, the main concern is murmur and some of the embolic signs that you're going to be seeing in there. So the major complications for endocarditis would be embolism and valve damage, whereas the complications with myocarditis are going to be heart failure and dysrhythmia. The main issue with pericarditis would be cardiac tamponade. And so what are the nursing priorities or NCLEX priorities that you need to know? First and foremost, you need to know that you need to put the patient on a high Fowler's position. Because of the pleuritic chest pain, you can give NSAIDs for this patient. And because cardiac tamponade is a very high risk or a major complication, then you need to watch for tamponade. Whereas in myocarditis, uh, administration of oxygen is needed and allow the patient to rest and monitor for rhythm. Whereas in endocarditis, you're going to have to make sure that there's going to be blood culture, there's going to be antibiotics for use, and you have to monitor embolism for that type of patients. So you can find this information that I'm sharing with you in my NCLEX Cram notes, which is located on my TikTok page under my Linktree account. Thank you for supporting that channel.